Dr. Clements' in-depth study of how the jaw bites and how the muscles work in one's face led him to the study and treatment of sleep apnea and TMJ.
Sleep apnea is when a person stops breathing in their sleep for at least 10 seconds. That's no movement at all. Hypopneas are partial interruptions of breathing, but apneas are total cessation of breathing. They're studied and measured in events per hour. How many times per hour does an apneic stop breathing? Anything over 5 times an hour is defined as sleep apnea. Anything over 30 is defined as severe. And we see patients here in our office who have 70 or more apneic events per hour where they stop breathing, so they never really rest. Their whole night is spent not breathing. Sleep apnea can occur in any person at any age. You don't have to be old and you don't have to be obese. Older, overweight people have more apnea than others. The problems of sleep apnea are severe decrease in blood oxygen. That can lead, first and foremost, to strokes. It can cause heart attacks. Any existing diseases that may exist, such as thyroid problems or diabetes, will be made worse by the lack of oxygen in the blood while people are asleep. Dentists have a very specific niche that they fill in the treatment of sleep apnea. Sleep apnea has to be diagnosed by a licensed medical doctor. Treatment for sleep apnea has to be prescribed by a licensed medical doctor. I can treat sleep apnea with dental appliances on the prescription of a licensed medical doctor. I see patients who have failed in their ability to use a CPAP. And they will talk with their physician, or they will hear of us through advertising or through friends, and they will come to see us to see if they can use a dental appliance because they're unsuccessful with CPAP. And that is the niche that I feel in the treatment of sleep apnea. When we see new patients here in my office for sleep apnea, we do a pretty detailed history of what their treatment for apnea has been up until this point. We review with them their efforts with CPAP, how successful or unsuccessful they have been with their CPAP. Once we establish that they fit the definitions for what we can treat, we'll do a clinical examination to be sure that their mouth will support a dental appliance. We will manipulate their jaw to see if we can improve their breathing and diminish their snoring. And if they fit those criteria, we will then approach their physician and ask for a prescription to treat the apnea with a dental appliance. The way our dental appliances work, the dental appliance advances the lower jaw more open and more forward. As the lower jaw comes down and forward, the tongue has to follow it because it is attached to it. As the jaw comes forward, the tongue comes forward, it comes out of the airway and creates more room for air to get in as patients breathe at night. Once we decide with a patient to treat their sleep apnea with a dental appliance, the process is pretty simple. We take an upper impression, we take a lower impression, we take a jaw position record, we take x-rays of the jaw joints to be sure that the joints are in a safe position. And clinically, that's the only needs that we have to fabricate an appliance. Our appliances are custom made. We use different labs around the country depending on that patient's needs. So each appliance is individually fabricated and prescribed for that patient.
I mean, I was snoring real bad. I mean, terrible. And then I would catch myself stopping breathing. I would wake up gasping for breath. I mean, just gasping. And I was clenching my teeth, and I was getting up all night. And I had to do something, so that's when I had the sleep study done and got the CPAP machine. And it was all right for a while, but I just had so many problems with the CPAP machine. Air leaking out. I would wake up thirsty all the time. I was getting up. I counted one night, I got up 15 times to go to the restroom. And it's just one thing after another, you know, and my husband would wake me up, Pat, your thing's leaking or something. And it was just, and you have to wash it because it's in 6 parts, you have to take it, you know, everywhere. And it was just such an inconvenience. My husband said, I think I'm gonna sleep in the other room. I feel like I'm sleeping with somebody that's in ICU, you know. And it was just terrible, getting up all the time and drinking. I would drink a glass of water like that every night. Wake up thirsty, had morning headaches. So the CPAP machine changed my life a little bit because I was able to sleep, but it was just such an inconvenience. But I was able to sleep a little bit with it, but then it caused other problems. and then came to here, and the changes has been astronomical. I mean, I can't even put it into words, the difference it has made in my life. Going one day to having no energy. I mean, I had none. I couldn't hardly do anything. And I would fall asleep. I'd be at people's houses and I'd, fall asleep. I would take 2 or 3 hour naps. And when I worked, I used to have to go out on my lunch break, on my breaks, and go sit in my car and sleep because I could not stay awake. Now, I stay awake and fully going all day long.